Girth pain, wither pain and stomach ulcer connection. Who am I? I'm Ian Bidstrup, a veterinarian who's been working on spinal rehabilitation of horses since the late 1980s. Some 25 years ago I started writing about girth pain and presenting about girthy horses, their prevalence and their relationship to thoracic birth trauma. What I've found over time from examining horses, talking to their owners, formally studying spinal problems and their treatment via chiropractic, acupuncture and regenerative injection therapies, and studying girth pain related research, is that girth pain is much more prevalent and much more involved than just aversion to having the girth wrapped around their chest. And it's much more than just stomach ulcers. Early on, as the links between girth pain and other equine problems became more apparent, I termed the phrase girth pain syndrome to encompass it all. Girth pain, or sensitivity to touch in the girth region, is for some horses a major negative about being ridden. What we will explore in this presentation is that how being girthy, or even silently girthy, is a very important red flag for a number of major issues that make up a wicked web of pain and dysfunction horses suffer. We will also discuss how to alleviate girth sensitivity and the many things associated with it. We are all aware that girthy horses are very common. What I'd like to do is change the common belief that most horses' reaction to the girth is mainly a behavioural problem or a symptom of stomach ulcers. The common symptoms seen when girthing up is that they want to bite their handler. That's really got rid of often in the breaking in stage. So they have to do something a bit different. They often will take out their frustration by biting at the rail or closing their eyes and squinting their eyes. They'll shake their heads at times. They'll swish their tails at times. They can get agitated or fidgety when the saddle comes out of the tack room, and also agitated and having a struggle to stand still when getting saddled. They can also kick or bite at the girth when ridden. Horses will brace against pain just like people brace against pain to help us cope. When horses inflate their chest and brace themselves during the girthing process, they soon learn that it leaves them with a looser, more comfortable girth. Self-inflation is one of the reasons that horses are commonly walked around and girthed up hole by hole until we're happy that it's going to be, the saddle itself is going to be stable while riding. High kicking at the start of the ride commonly goes with being girthy. These horses will seem to settle down after a high kick or two, and you have to wonder whether they actually help themselves free up or accommodate to the girth and saddle in some way. Most often high kicking is found to happen during transition from trot to canter on the flatter shoulder side, or one side in particular. Sometimes it can be both sides. Even more often horses just appear to brace themselves against discomfort, tightening and lifting their backs and sort of humping up as they do so. Bucking is something that very often goes together with being quite girthy. A lot of the time this is put down to sacroiliac problems, but what I find is that bucking will stop very shortly after treating the upper thoracic area, as happened in this horse here, and the horse becomes much more comfortable through the thoracic area where the saddle is placed and the girth. So bucking too often will occur not when just trotting in a straight line, but when we go from a trot to a canter, particularly on the lead that they find more sticky. Other things that go along with being girthy is working against or coping with discomfort. Horses wanting to over race or bolt, working with high head carriage and neck carriage, horses not settling into a walk, always wanting to jig jog and go heavy on the bit, wanting to move all the time to cope with the pain, it seems. Western horses not wanting to take a nice lope, that they rush through their pace. Horses on the lunger or at a trot just wanting to run or go silly. When lunged with the saddle on, girthy horses may want to work long and low until they're quite warmed up, perhaps to strategically reduce the saddle pressure on the more tender parts of the wither as they do so. Asymmetry we covered very well in the last presentation, and I'll get you to go back to that to have a closer look at what I said there if you haven't already seen that presentation. It starts with foals wanting to take one stance for grazing preferentially. We've seen very commonly with uneven platforms in a smaller or less pronounced shoulder, coming from the horses leaning on the bigger shoulder most of the time. From uneven heel height, the leaning can cause them to have deviations of the leg, turning in and turning out. Can also see from that uneven saddle platform that we get the saddle falling to one side, and this, I think, is a big component of what upsets the pelvic balance in the riders, because we have very common patterns and riders, I think, become the more common pattern. Also, the pelvis seems to get involved with the asymmetry. Other symptoms of discomfort are swishing the tail, especially when there are saddle problems as well, with saddle fitting and saddle design. Also, ears back when having to step out, especially in those more affected by girth pain, and again, more especially combined with saddle being a problem to them. We also, of course, see this with sore feet and other sort of things in horses. Being cold back is another common thing with girthy horses, that they'll tense and drop their back as the rider mounts, gets into the saddle, and for the first number of strides, the horse leaves its back down in a brace position and then comes up into normal posture in time. Other symptoms that we see that are associated with being girthy is not moving forward at the start of a ride. The term napping is used in parts of the world with a horse. A horse really acts sort of like a car with its brakes on, handbrake on full, trying to head off. And this is for very good reason in the musculoskeletal system. They step short in front until not warmed up. They have trouble taking one canter lead in particular, trouble bending to one way and overbent or hollow on the opposite side. The haunches tend to be in on the hollow side. They resist leg aids quite often, especially on the left circle. The pressure on the side of the chest can be uncomfortable on the stiff side, but it also, there's resistance to being able to bend that hollow side and straighten it up. That is, I think, a very big part of the problem. Shying and being anxious also goes very much hand in hand with girthy horses. Well recognised causes of girthiness in horses include learnt behaviour, girths being over-tightened or uncomfortable or inappropriate, poor technique in applying them, uncomfortable and ill-fitting saddles, we'll talk about more, certainly part of the problem. Referred pain from stomach ulcers can certainly be a part of the problem, and we'll explore these a bit more later on. What we really want to concentrate on today is spinal dysfunction, because that's the elephant in the room and it hardly gets a mention. In my experience of spinal treatments of well over 12,000 horses, including a large number of foals, weanlings and yearlings, spinal trauma occurring during birth is the key issue in girth pain and abnormal girth sensitivity. I find birth trauma commonly leads to chronic spinal mobility restriction, otherwise known as spinal mobility dysfunction, that the brain appears to accept as normal spinal motion, and herein lies a problem. The short version, spinal mobility restriction leads to distortion of the afferent nerve signal feed to the brain and the efferent nerve signal going from the brain to the tissues. Current human research suggests, as a result of the change of spinal nerve environment, that the brain does not set muscle tension correctly, usually leading to affected muscles being tighter than they should be, and the brain itself doesn't read the sensation from the tissue correctly, leading to various paresthesias like pain or itching or tingling of the tissues. For more information on the related issues with spinal mobility dysfunction, see my birth trauma presentation on YouTube. Foals consistently show pain in the girth region. Every foal I have looked at from a day old onwards shows considerable pain through the girth area. And if we look at the research papers on girth trauma or birth trauma in foals, we can understand easily why. They've got to be bruised right through the chest area and very uncomfortable. Usually this pain eases as they become weanlings and yearlings and then adults, but local pain is persistent in most, and remnants of this pain in my clinical experience usually remain for life. Like adult horses, foals become more comfortable once the birth-related spinal dysfunction is effectively addressed though. You can really change these things. Clinical experience tells us the sooner and better the spinal dysfunction is dealt with, the less asymmetry, posture and training problems the horses are going to develop through life. With adult horses, symptoms of paresthesia, including irritability of the skin and various types of and intensities of pain, are usually found in association with the girth and wither region of horses. The skin of the wither and the girth, the spinalis thoracis at the wither and the serratus ventralis under the girth appear to be the most affected. In foals from birth onwards, in weanlings, yearlings and adult horses of all ages and all breeds, I commonly find pain and other forms of paresthesia associated with the upper thoracic region, with the girth and the wither area under the saddle being the most affected. Higher withered breeds with correspondingly deeper chests are normally more affected. Lower wither breeds are usually less affected and interestingly also seem to show less asymmetry and laterality. Hot bloods like thoroughbreds show their sensitivity more than cold bloods like draft breeds. Cold bloods take more careful palpation to reveal the sensitive areas, but mentally can be just as effective as obviously affected hot bloods. Mares complain about their troubles more than geldings most of the time. Colts and stallions are often quite sensitive to any irritation. They seem to be fairly sensitive pedals. Chestnut and black horses are usually more sensitive to irritation too, so beware if you have a high withered chestnut or black mare. Let's look at examining the girth on a relatively pain-free horse and also one that's quite affected. To start the process for a horse that you're looking for girth pain in, this is one of the key areas we're going to look for. There's often trigger points here that are associated with girth pain. And if you're having trouble revealing that, then rubbing your finger up the rib cage like this will expose that trigger point quite well. You might have to use your whole hand, but you're going to just quite comfortably rake up here, and that shouldn't really be uncomfortable for a horse, a normal horse or a horse that isn't suffering girth pain. This guy is a good example of very irritable nerve pathway down through the girth and the back of the shoulder. So the long head of the triceps here is very bouncy. You can see how just light tapping, and I'm hardly touching him here, is causing him to change the whole leg. So that's all the passive stay apparatus is affected there, because this is all part of the stay apparatus. Now down in here, this is the serratus and also the cutaneous trunci muscles. These are all quite easily irritated, and he's not in pain. He's actually standing here quite happily, but this is irritable tissue, and we'll show you after we've done some high velocity short lever chiropractic on him how this changes. Often strains the attachment up here when it's established for a long time, and around here this is not so much activated in him. He's not being stressed by too much work. The other side of it is through the wither here, and he is quite irritated through the wither, and that if this has a saddle on it, this region, and it's irritable, then it's just going to tighten up and he's going to brace up, and it's going to contribute to him being quite nervous. So again, right through that area and right up into here. All service from the same vertebrae, which is, this is the shoulder blade, directly under the shoulder blade here, the vertebrae, and the spine is coming down here, and then up through here, and up about that level. And this vertebrae, or pairs of vertebrae here, are not moving properly, and that's affecting the comfort of here and down here. Okay, we're back after some high velocity, short amplitude chiropractic on the wither vertebrae. So this is the triceps muscle that was bouncing all the time. It's still got a little bit of reactivity. There's another component from the lower neck that's all associated with this. So much more settled. Through this region here, a little bit of reactivity, which I will deal with, but it's not fully done yet. But same sort of irritation as before, more irritation, and we've just got virtually no reactivity, but there is about 5% left there, which I think is reasonable at this stage. And up in the wither, where he was really quite sensitive, I can press on that quite firmly without him getting too agitated now. And if I press my hands together either side, then he would not be all that uncomfortable. But things are still resolving, but much better. Rearing up and going over backwards. As well as birth trauma, horses, especially the hot types like thoroughbreds, frequently rear up and go over backwards, landing with great force on the wither. And this doesn't have to be at the end of the lead with them pulling backwards and overdoing it and landing over on their croup and their wither, and sometimes hitting their pole fatally. It can happen in the paddock as well, where they're just having fun and rearing up and going over backwards as a result, when they just go a bit too far. Distortion of the upper or dorsal growth plates of the wither often result and are left as evidence of the impact on the wither. In more nasty cases, fractures of the dorsal spinous processes may occur. This injury from going over backwards is also going to cause spinal dysfunction in its own right, in addition to winding up existing dysfunction from birth trauma. This horse is a good example of one that's had damage to the wither outline. The wither of a horse should be a nice, even curve all the way through it, and this is something consistent with virtually all horses. So if we look at spinal dysfunction in humans, because they're great guinea pigs for us, why not use a bit of human research? This happened back in 1939 with Kellgren, and they used volunteers and injected hypertonic saline around the zygapophyseal joint and mapped out the pain patterns that the volunteers relayed from having those injections. And the interesting thing about this diagram is that the pain patterns around the vertebrae very much are similar to what we see in horses. So in T4, 5 and 6, this matches the saddle and girth, the front of the saddle and the girth area very well. So in a very similar pattern coming from around the zygapophyseal joints. This same sort of research was repeated in 1954 with more poor volunteers and left a similar pattern, even though this diagram doesn't make it so clear. It was further verified by treating zygapophyseal joints with local anaesthetic when the pain pattern suggested that there was a problem with those zygapophyseal joints. So you can see the pain patterns that were emanating from C2-3 might be of interest to you, coming right across the head, say C5-6, the lower shoulder area. But getting back to the saddle and girth, T4-5, again, was in a very similar sort of location as what we have seen in the other ones and we see in horses. The other thing that's reported in humans by physiotherapists, osteopaths and chiropractors is a syndrome called T4 syndrome, where around T4 there's spinal mobility restriction that produces its own pain and dysfunction pattern. And part of this syndrome can be diffuse pain in the arms, paresthesia of a whole arm or just the forearm. You can have extreme hot or cold temperatures of the hand. Imagine that in the foot of a horse. Heavy feelings of the upper extremities and non-dermatonal pains or aches in the forearm. So really pointing to the sympathetic nervous system rather than the normal motor control of the muscles in the forearm and the skin. Sensation like tingling or pins and needles also happens in the arm. So this is not a particularly common syndrome in humans, but it is a very significant one and has a lot of parallels. The other thing that's seen in humans that's of note and has parallels with horses is acute atypical chest pain. So you think a person suffering this sort of pain is just going to be a cardiac patient. Well, it turns out that 40 to 60% of people presented at emergency departments are not suffering from cardiac ischemia or cardiac related pain. They're suffering rather from referred pain from the musculoskeletal function or from gastritis or gastric ulcers. Covers most of the ones that produce this acute, painful, stabbing pain quite often. If we compare this to horses that are girthed up and drop to the ground as they're girthed up, or they buck frantically around the yard after being girthed up, then perhaps we ought to think that perhaps too they're having acute stabbing pain that's causing this, and we should be dealing with the dysfunction instead of just labelling them as being particularly sensitive and bad players. Let's start by looking at the innervation of the girth and where it's coming from. What you see in red there is innervation from the fourth thoracic vertebrae and from the cutaneous nerve coming out from that. If we just march our way back through to the seventh, we cover more than the girth area of the horse. What we commonly see with the skin in horses that are highly affected by girth sensitivity is that the skin is hyperreactive. It's not just the muscles themselves. The skin is moved around by muscles, the cutaneous trunci underneath them. And if there's hyperirritability of the skin, then it can mean that the skin's always going to twitch as soon as you put a girth on it. And it can make habituation, which is a questionable idea in itself, to the girth a very difficult thing for the horse and difficult for us to achieve in some cases unless we actually start thinking about what's going on that's causing that irritation. Moving the skin, as I mentioned, is the cutaneous trunci, and it's very extensive. It covers pretty much the whole of the chest region and joins on to the omobrachialis up the front of the leg. So if you look at the wither part of the deal, together with the cutaneous omobrachialis and their fascial extensions, the cutaneous trunci also moves the skin over the wither. Dysfunction-related hypersensitivity of the skin of the wither results in overactive twitching, as seen above the shoulder blades when you try to touch or brush them there when they're irritable through this whole section. And this heightened irritability can lead horses to twitching their skin under their rugs and rubbing their skin raw in the process, as well as being part of the horse being adverse to having a saddle on. Like that of the girth area, this irritability settles dramatically once the spinal dysfunction is adequately addressed. It's not a matter of just putting a satin bib on so they don't harm themselves when they're rubbing. It's a matter of getting rid of this irritation by dealing with the source. The latissimus dorsi is obviously directly under the saddle, and the upper part of the girth sort of runs over it. The muscle comes over the rib angle, so there's a hard bony prominence there. So this muscle can be irritated by having a saddle pushed against it. And active trigger points can be present in that muscle, shortening and increasing the resistance of it to having the leg move forward in the horse. If we look at the situation in humans. There is a common trigger point that's found in the latissimus dorsi heading into the axillary fold. These trigger points are actually known in humans to cause constant aching pain into the dorsal corticoscapular region and down the quartermedial aspect of the arm. So if this is happening in horses, we should be a little bit more sympathetic to them, I think. And the next muscle we're looking at is the serratus ventralis, which has been a constant through my treatment of girth pain for all this time. This one is directly crossed by the billets or long girths. Often it appears to have reactive trigger points present down towards the tip of one or more of the fingers of it. Active trigger points in this muscle can shorten the muscle, pulling the upper portion or the dorsal part of the scapula downwards and rearwards, flattening it against the rib cage. In horses, these trigger points can be readily found by the jump reaction as the finger pressure is brought over the ventral to dorsal area of the lower serratus ventralis muscle behind the elbow of the horse. We'll demonstrate that in a video later. This trigger point in the serratus in horses has got a matching one in humans, and it's very similar in many ways. One thing that's interesting is that in humans, this trigger point can cause chest pain even at rest in more severe cases. And pain from these trigger points can be aggravated by a strong effort to protract the shoulder girdle, just as we see in horses that don't like their leg pulled out as well. The long head of the triceps muscle is often seen to be affected by dysfunction of the upper thoracic area that's seen in conjunction with girth pain as well. So we need to mention that here, I think. They're often down the whole length of the long head of the triceps. This muscle is often quite stringy on palpation. And these trigger points really come alive when you start stretching out the leg. And if you want to make them obvious, stretch out the leg and then palpate down the long head of the triceps, and they'll stand out even more than before. And this has got to make it very uncomfortable for the horse to bring their leg forward for the farrier. This muscle's got to be stretched out. And we all know farriers have a lot of trouble with horses that are reluctant to stretch out one or both forelegs. Also, by restricting the forward stretch of this muscle, the trigger points act to inhibit the horse when attempting to extend their stride from trot into canter. We've got to make mention of the passive stay apparatus when talking about the triceps in particular, because it's such an essential part of the stay apparatus. When tense and shorten, this muscle also acts to tighten this part of or the rear of the passive stay apparatus, and in doing so adds to the tendency, in my experience, for the hoof and the fetlock to be more upright. In foals, I've found this to be an important component of foals being overly straight in their front legs, and a major contributor to high heel, low heel conformation in weanlings through to adults. The ascending pectoral muscle is also one obviously impacted by the girth, and this muscle is often implicated in girth pain. However, in my experience, it is normally one of the less painful areas compared to the others. Innervation is from the lower cervical nerves and the thoracic spinal nerves via the intercostal nerves. Some very nice work was done by Bowen et al. On mapping the trigger points in this area in 38 horses. And the interesting thing was not only the number that were picked up in the horses, but also that on the right side there was a greater tendency for tenderness than the left side, particularly down towards the midline of the horse. Humans have parallels to this, and shouldn't be surprising that we're seeing trigger points in people in this area with our posture for our devices that we have and on computers and things, that this area is just hammered all the time and is kept tense and overworked, and so there's trigger points in this area here. The other interesting thing, besides there are occurrences that are similar to seen in horses, is that These refer pain into the interscapular region as well as the local region and involve the trapezius and rhomboid muscles particularly. And also the pain may radiate down the medial side of the arm and fingers. So another source of pain in the lower leg, potentially in horses, that's not related to local structures in the leg. Muscle trauma induces hyperactive foci or trigger points in affected muscles. Spinal trauma-induced upper thoracic spinal dysfunction increases the tension and tenderness of muscle that the affected spine innervates. The increased tension leads to the muscle being more prone to strain, injury, and creation of injury-related trigger points. And spinal dysfunction also winds up the irritability of existing trigger points in the muscle from previous damage. And this really plays out for lower back injuries in people that tighten up the hamstring muscles and then they kick a football in Australia and in AFL and strain their hamstring. And this happens very often as a result of low back induced dysfunction or low back function that induces the tension that then exacerbates the problems with trigger points in the muscle. If we look at the upper side of the girth region as well, it's affecting the skin of the wither, but also the wither musculature. While the ventral branch of the spinal nerve from the dysfunctional segment innervates the girth area, the dorsal branch innervates the top line, skin, fascia and muscles. So we need to look a bit more closely at those. The longissimus dorsi offshoot, the spinalis thoracis, is directly innervated by the upper thoracic spinal segments that are commonly affected by birth trauma. This muscle very frequently shows increased tension and tenderness in all ages of horses, ridden and unridden, in association with spinal mobility dysfunction. Treatment via appropriate high velocity, short amplitude chiropractic also will dramatically reduce the tenderness of this muscle. So as well as getting rid of sensitivity of the skin or diminishing that, it also will reduce the tension and tenderness of the spinalis and upper thoracic muscles. The tenderness of this muscle can be easily revealed by compressing the muscle against the bone with inward digital pressure, as in the picture on the right. If you just come from the surface and press down, you'll only affect really the muscles directly under the skin, the trapezius and part of the rhomboid, but you really need to actually push more against the bone. And it's actually the bone surface of the spinalis thoracis that's most affected, we think, from what's happening in human research. The muscle tension and tenderness of this muscle appears to lead to pain for the horse where saddles come up high in the wither and impact this portion of the back in particular. And this is really a common occurrence. If there are short tree points on the front of the saddle that are pushing in up high, that makes it even worse than if there are long ones that are spreading the weight of the rider further. If the saddle is wide for the horse, so instead of being parallel to the horse, it's actually wide like this, it actually contacts higher up more than lower down and puts more pressure in that area as well. So broad or saddles that are too wide for the horse rather than broad, too wide in angles, can be a real problem in that regard too. Tension in this muscle can really have a big impact on the horse. It tends to inhibit the abdominal muscle action, the contraction of the abdominals that are necessary to lift the back and work against the long back muscles to actually create a solid chamber to hold us up. These muscles, if they're inhibited by tightness and tension through pain in the upper wither area, we'll see these always dropping and the back dropping, and this leads to interspinous strain and kissing spines, particularly through the middle of the back as it does so. It also leads affected horses to be resistant to stretches involving lifting the chest. With that muscle tight and tender, it inhibits them actually coming up, or makes it uncomfortable for them to come up. And as a result, they brace and make it hard for us to achieve anything. And even if we do manage to get them up, the horse is not necessarily going to adopt that as posture, because we haven't got rid of the reason that it's occurring. The lower neck also gets affected by tension of this muscle being pulled in by the tension in the spinalis thoracis that shortens the muscle as well. It is dragging on the lower neck, lifting it into a more vertical posture. That vertical posture is putting pressure downwards on the zygapophyseal joints of the lower cervical vertebrae and likely increasing lower neck pain and arthritis as it does so. And this is something I see very much happening in practice. Tightness and tension of the upper thoracic region also a big contributor to postural imbalance in horses. In this case, high tension through the thoracic girdle is drawing the front end inwards and downwards, making the rump high conformation the horse has even worse. Wither tenderness and saddle fit is an issue that should not be left out of this conversation because it's so super important. Tightness and tenderness of the wither muscles, and particularly the spinalis thoracis, that results from spinal mobility dysfunction is a major complicating factor for saddle fitting. Wither tense horses often maintain normal posture for standing saddle fit checks, and the saddle may pass all the saddle fit checks with flying colours. But as soon as a rider is in the saddle, the horse drops and tightens its back. Dropping its back completely changes the shape of the horse's back line and the wither angles, leading to the saddle no longer fitting as it should. With the back drop, the saddle loses contact through the waist, leaving excessive and painful pressure through the already tender wither and back of the rib cage. The excessive pressure adds to the pain and muscle damage and encourages the horse to tense and drop its back further. And the spinal dysfunction behind the tenderness of the muscle gets further wound up by back pain. Commonly, it is not until the underlying spinal dysfunction and back pain is resolved that the saddles start working for the horse. Using treeless saddles on broader horses sometimes allows the horse to retain the same level of comfort as prior to starting to drop their back, but the reason for the postural drop is not addressed, and the posture will remain suboptimal, as will the horse's comfort and biomechanical soundness. The cascade of tightening the wither and dropping and stiffening the thoracic spine usually leads to raising the loin and increasing the lumbosacral angle in order to compensate for the drop through the thorax. The hind legs tend to trail behind the body and behind the vertical as a result, likely adding to greater impact on the dorsal metatarsal margins and probably contributing to hock arthritis as it does so. Also, it's highly likely the tension is increased in the back of the lower legs. When a horse affected in this way must round its haunches and get its hind legs under it to crouch as it acts to cut a cow or to perform piaffe, then the increased tension at the back of the leg is likely to contribute to the high suspensory strain that is commonly recognised in performance horses. So this problem that we're talking about of upper thoracic tension and tenderness is actually made worse by a number of other factors that occur with horses. Rider-induced ones include false collection, with the head and neck being brought in and without, because the chest doesn't lift for you. If you try and compensate by just bringing the head and neck in, and sure, you can sort of add to their stability with your reins doing that, but what happens is it actually exacerbates the pressure on the lower neck and increases the potential for strain of the lower neck joints and arthritis occurring there. But it also adds stress to the upper thoracic region and exacerbates what's happening with spinal dysfunction there, and then winds up the girth-related pain. So coming into false collection can be one of the worst things I see for actually winding up girth pain in horses. Of course, other things that bother the horse in the way of leg-induced pain, such as lameness from a leg, and typical leg lameness, or laminitic horses, really increase the wind-up of dysfunction through the upper thoracic area. And laminitic horses particularly are ones that will wind this up. And because they're not moving around much, this is very poorly recognised, and it actually winds up all the problems that are occurring through that area, and that causes more pain, I think, for these hoof-pained horses, that they become quite painful through the body at the same time. And easing up the dysfunction in the upper thoracic area can really help these horses, can improve their quality of life, and you can see them actually relax a lot more. And there's some that would say that the wind up of problems in the upper thoracic area is actually affecting the blood flow to the leg as well, and winding up the laminitis. So there's lots of advantages to actually giving the horse some relief from dealing with upper thoracic spinal dysfunction in these cases, as well as dealing with the laminitic component, the foot component. There's lots of other things that will cause changes in posture around the head and neck region, such as pain in the poll area, nose band pain, dental pain, bit-related pain. Any pain in the head region usually leads to high head carriage and jamming up the lower neck as a secondary thing, dropping the thoracic regions, again loading the upper thoracic portion of the spine, so winding up any girth pain. Fear and anxiety. The high head and upright neck stance of anxious and fearful horses not only jams up the spine of the lower neck, but also adds to the tightening of the upper thoracic spinal region. The fear and anxiety is often associated with sympathetic nervous system overdrive, and that we know has its negative effects on stomach function and potential production of stomach ulcers, but it certainly also winds up the upper thoracic spine. And these two things feed each other, winding up pain in the girth region, adding to fear and tendencies to shy, and everything just escalates and gets worse. Let's look at a video on just going through the postural aspects in a more basic sense. This Galloway's a new purchase for the owner and has come with some problems. His posture in general, you can see how he's dropped through the middle of the back and is a bit peaky in the rump, and if we look more closely, he's very tight in the neck and has got some arthritis there, which is really common in association with tightness through the wither area. Tightness through the wither area has been part of what's caused him to drop through the back, and I think there's been issues with previous riders that have perhaps had the wrong sort of saddle and perhaps been a bit heavy for this part of the horse's back, maybe a saddle that's been made short to fit with his shorter back and then put too much pressure on this region. So he's got some evidence of strain and kissing spines along this area through where he has pushed down the back. Where I've got a circle there, we've lost muscle, we've got muscle atrophy, and as a reciprocal of that, we've got spasm through the loin, and this often happens where they've got drop in here, the back has got to actually seesaw and make up for the fact that it's down here by going up here. Otherwise the pelvis has trouble connecting to the body. The soreness that's really contributing, and I don't know whether you can see him ducking away from my fingers on the other side, is particularly soreness down through the wither and down through the girth, which he's got on this side, but particularly through the wither on the other side. So on his other side, what I was saying about him being quite sensitive through the wither, you can see how he's dropping readily through this region. The saddle pressing in on this region, pushing the muscle against the bone, will make him uncomfortable without treatment, and may even be a little bit problematic through his life, through this area. That it's a residual problem of birth trauma often that's affected the spine under the shoulder blades, and it affects this region here and down further into the girth down below, so they become quite girthy. I'd be remiss not to mention fascial chains, but I'll actually leave that to Dr. Ricky Schultz, who'll be talking on this on Centaur Biomechanic Forum later in the year. So she will fill you in on its effects, including that related to birth trauma. Getting down to stomach ulcers. The connection between stomach ulcers and pain in the girth region of horses has been clinically well established via the response to gastric ulcer treatment for some time. Treat horses for their stomach ulcers and girth pain will decrease in a good portion of them. However, we all know it doesn't help all the horses. In practice, I find girth pain is still present in all horses concurrently treated with ulcer medication. Usually the owner reports confirm that it has reduced the signs of girth tenderness that are apparent to them, something that is a good outcome, but sadly it doesn't mean that the stomach ulcers were the primary cause of the girth pain or the only thing going on. The associated nervous system control tells us why this is so. In humans, stomach receives its sympathetic nervous system component of its control from segments T5 to T9. These same spinal segments supply the skin and muscles of the wither and the girth in the horse. And if we consider the horses getting much of their stomach sympathetic nervous system controlled by roughly the same spinal segments as found in humans, then we have a very good match for this control of stomach function and nerve supply to the muscles of the skin and wither of the horse. Trouble in the regulation of the musculoskeletal tissue spins off to cause trouble in the associated organs. Thus, dysfunction in the spine, which on one hand causes increased girth tension and tenderness, will also lead to an increased neuronal activity in the spinal cord, and neuronal excitement will in turn overcharge the message supply to the stomach, upsetting stomach function, with the likely results being a tendency for stomach ulcers or gastritis. If the spinal injury is more extensive and involves spinal segments providing control to the heart as well, then overcharging that area of the spine may lead to things like heart rate increasing, and in doing so, further adds to the sympathetic nervous system overdrive. A heightened tendency for fright and flight and a poorer gut function are all common with sympathetic overdrive, think stress, and stomach ulcers are again the likely result. This is a common issue I see when there are considerable spinal dysfunction present in the upper thoracic region of horses, an issue which usually settles dramatically with adequate treatment of the spinal dysfunction. This is borne out in practice with horses that are very difficult to keep conditioned on prior to treatment for spinal dysfunction, turning around to putting on weight readily after treatment. The bottom line is that both pain from the stomach ulceration and spinal dysfunction of the upper thoracic spinal segments feed one another to considerable negative effect. In the clinical setting, this is very apparent. Keeping stomach ulcers to a minimum via good attention to addressing anxiety, food sources, dental health and feeding practices, and where necessary using ulcer medication will reduce the negative nervous system input into the segments of the spine that are also important for a healthy state of the girth tissue innervation. In my opinion, it makes a great deal of sense to me to use ulcer medication in a preventative way when horses have travelled considerable distances or change locations and owners, until they settle in, that is. Keeping spinal function of the upper thoracic spinal segments in a healthy state will remove the negative flowback effects on the stomach function, reducing the likelihood of stomach ulcers too. So we mentioned these things earlier on. Learnt behaviour is certainly a real deal, but sadly it's often considered the main issue, with the rapid force and forceful tightening of the girth being considered the main reason behind it. Well, it's far more than that, as we've been discussing. Certainly it's unnatural for a horse to have a band around its chest. However, we've been selecting horses for 100 years at least for the compliance of having tack on them. So the horse's body, if the horse's body is in a comfortable condition, it should be something they readily habituate to. And contrary to the belief it is mainly learnt behaviour, is reactivity of the girth can be greatly reduced or removed with effective treatment of concurrent spinal dysfunction, attention to attack issues and to stomach ulcers. Just whip through this because we're going to cover this in another presentation I'm doing later in the year for Centaur Biomechanics. Saddle girths certainly need to be comfortable for horses, and there's some are much more comfortable than others. There's others that are too thin and not getting the best effect for your horse. There's some that are brilliant for the horses that they're made for, but they cut in on the wrong sort of horses. So they've got to be designed for the right ones. Over tightening the girth is a really negative thing for the horse and can lead to girth pain and winding up horses' behaviour, which can be negative to the idea of stabilising the saddle, and also reduces race performance for that matter. Uncomfortable and ill-fitting saddles, we've touched on those already. If they're not comfortable for the horse, then they're going to have a lot of consequences. They're going to make them more uncomfortable with just having a saddle put on them. These need to be addressed too, and again we'll talk about that in the presentation that is occurring at the end of November for Centaur Biomechanics. Treatment of spinal dysfunction. Your spinal rehabilitation professional plays an essential part in the resolution of and management of spinal dysfunction. A whole horse approach is actually what delivers the best results. Addressing the body, the hooves, the legs, the teeth and the tack are all essential to getting the best things happening. The 4th to the 8th thoracic spinal segments are the key targets for treatment, and this has been illuminated by the birth trauma research that I discussed in the last presentation. The principal dysfunction that is occurring is restricted vertebral rotation, but extension and flexion of the vertebral segments also needs to be addressed too. It is essential that the rib cage is included in the treatment, as changes in the mobility of the vertebrae need to be synchronized with changes in the mobility of the ribs and also of the muscles that control the mobility of the rib cage itself. Practitioners trained to a high level in veterinary chiropractic and osteopathic diagnosis and treatment are usually very effective in treating girth pain and wither pain. Acupuncture, massage therapies and fascial release ideally should be part of their approach. Home exercises to enhance the effects of professional care should be encouraged. In the next video we're going to go through some of those ones that you can do at home that can make a real difference. So we're going to do some exercises to help girth pain in horses, and Norman's very kindly volunteered to be the mannequin today and helping us with that. So the first exercise we're going to go through is actually just getting the chest to move in such a way that it's engaging the spine and the ribs at the same time, and engaging all the muscles that actually support the girth area and the shoulder girdle and the front of the chest, so we can see how things move together, but also we want to encourage a little bit of extra movement. This should be done after a professional's freed up your horse, so it's not to be a standalone thing, it's really to help enhance what your professional help has done to improve the mobility of the spine. So we're going to start with the hand at the front is going to work on the contact the sternum right here, so you're just going to cup the front of the sternum. The other one is going to go underneath the chest, And we're just going to start very lightly, and the action is going to be, if I can swap my hands around, is going to be coming forward with the sternum and lifting backwards with our hand. So moving this way and this way. So it's just getting a flowing motion in the chest. And this is really good for re-coordinating the muscles in the chest, because there's a lot of relearning to do. We're going to be just nudging backwards and nudging backwards from underneath, and moving that in a rhythmic fashion. And you can see him moving backwards and forwards, and from the front you can see how his pectoral muscles are readjusting his posture all the time. And you should do this for at least a minute at a time, and just slowly and gently. And they should be, the professionals should have got them comfortable through the belly here, so that my hand underneath should be quite comfortable. And the aim is to get them to progressively lift their back like you would with a chest lift, but in a more gentle way. And at the same time, the horse very often will drop their head. So some horses find it a bit confronting because you're taking over their breathing a bit, but most of the horses, if they're free enough in the spine, will allow you to do it. And this really enhances the connection between all the muscles, the ribs and the vertebrae, all working together. That's one of the main exercises we want to do. The other one we want to do is a series of neck stretches. And we normally start with lunging over poles, and then we go on to the neck stretches, and then we go on to these chest motion exercises. But the neck exercises are a mixture of standard ones that are common to use and an extra one. So I prefer a molasses-based horse lick of some sort, but you can use treats to get them to come out wide and then around towards their hip bone. You can also get them coming towards their stifle and from their fetlock. I find carrots are a bit of a tease for the horse, because you're actually asking them to come and hold and not get it straight away most of the time. You don't mind your carrots, do you? The other standard one, of course, is coming down in between the front legs. And you don't want to drop them down too low that they actually buckle in their knees, but down between the front legs and holding there. And the extra one that I was talking about is to put your back to their shoulder. It's over here. Back to their shoulder and actually come out wide. And this time we're extending him forward. And get him to stretch right through, and this is to stretch him through under the shoulder blades and right back to the opposite side hoof. So it's a stretch right through all the fascial chains of the body back to the front hoof. I've run out of carrots, Norman, sorry. These neck stretches are super important to help this area here as well as help the neck itself. These exercises should be repeated twice ideally, and ideally with them, if they're licking a molasses lick, then you can actually bring them around slowly and just let them lick as they go, using their jaw less, which reduces the interference that the jaw is actually masking what's happening in the body for the brain. And by coming around, they're just enjoying their time around licking at the molasses lick, and it becomes a nicer thing for them, to me, rather than what might be for some horses a bit of a tease, that we're holding it and waiting and then they get it. So it's a sort of a process that's not so much fun for them. These neck exercises and even the chest easing, if you like, ideally should be repeated twice, and you should do that at least every second day, if not every day. And it's to me an essential part of helping maintain comfort through this region. The next exercise we'll go through is one that's we're going to do directly on the spine. And what we're going to be doing is, if this was the spine from the front, we're going to be actually gripping it from the other side with just a couple of fingers over the tip of the vertebrae, and we're just going to be nudging the vertebrae sideways just a few millimeters and working our way along the wither. We're just contacting with our fingers on the other side and just very gently nudging each vertebrae a little bit to us. And this should be gentle, and it's going to be a little bit uncomfortable for the vertebrae that aren't totally happy, but it's going to be encouraging to it's going to help the nervous system to get back to a proper frame of action. It's going to help reprogram the nervous system to cope with better or more correct movement of the spine through the upper thoracic area. You should do it on the other side as well. And just doing once each side is probably enough at one session. But this is aimed at stimulating the connections between the spine and the brain. Righto, the third exercise we're going to do is to work on the shoulder girdle alone. So we're going to be making a contact on the back of the elbow here. So we've got the point of the elbow and the back of it, and we're going to be lifting that. We're going to actually just gently encourage it to come upwards, if you like. The other contact is on the front of the point of the shoulder, and we're going to be coming in close to my body to do this one. And this is the aim of this one, is to take the point of the shoulder downwards. And what we're aiming to do is to rotate the shoulder through this sort of motion and shorten these muscles here. So the actual action of it is because we're shortening these muscles and also taking the pressure off the ones below. And we do that mainly by moving him across a little bit in a second. So he's weighting the other side. It'll take the pressure off these inside muscles, and by shortening it, we're taking the pressure off these ones. And what that's allowing is allowing the body to unwind through this shoulder girdle, because that gets wound up when they've had chronic dysfunction that's occurred through the upper thoracic spine. So again, getting in close here and around at the elbow, we're lifting up. And we need the horse just fairly straight while this is happening. And we want him to breathe through it. It's a very gentle, very subtle thing, but it can make a real difference to the horse. To do this, what you'll hear quite often is little clicks or pops underneath the shoulder blade. You'll often get a horse relaxing and licking and chewing while this is being done, if he's not thinking about carrots, that is, at the time. And you'll get even more relaxation through this whole region. And you can maintain a bit of pressure there and also continue to the belly and do a bit of a chest lift at the same time, and then go back to your elbow and just hold that stance there, and it will help release all this muscle here and take the tension off and ease the pain through this area if they've got any. And I think that'll do. Thank you. Thank you. Thank you for attending this presentation and sitting it out so long as to get to this page. My hope is this presentation brings more veterinarians and more spinal practitioners to take girth pain and the wicked web it's part of much more seriously, and are more proactive in recognizing and dealing with it in their practices. Thank you.